Hey everybody, my name is Dr. Lynndy, and today what we're going to be looking at doing is to give you some pointers on what we can do to actually get through this cold flu season that we're going to be dealing with. It's already been mentioned that we're going to have a dark winter. They're thinking that they're going to have double the amount of deaths from coronavirus, and we're going to be dealing with a lot more stress from going through the cold flu season. So what my goal to do is to actually get us educated on these things so that we don't have to suffer with these things, so we can make it through this season alive and healthy as best as we can. So there's 4 things that we need to actually focus on, and I'm going to try and be as fast as I can on these things. I'm not going to talk fast because I talk fast, and most people already told me slow down my videos so you can actually interpret this stuff and get the information instead of having to go back or even not even understand me. So we're going to go easier on these things, but there's 4 things that we need to focus on for sure. Just to let you know, before those 4 things, you have to know a little bit about me. I'm a chiropractic physician. I was raised medical. I was actually going to be a surgeon at one point in my life until I started learning more about nerves. Once I started learning nerves, I was like, wait a minute, name one drug that fixes one thing. I had trouble to think about which drug could even actually fix one thing. Well, it doesn't. They make it look better on paper and it manages it, but it doesn't actually fix it. So I'm trying to figure out, why did your body do something weird, and what can you do to get your body back to normal patterns without having to take something that's unnatural for your body. Okay? So I'm looking for the natural things. That is my goal. I am all about human potential. I want to see your body get to a new level of function. At the same point, I'm also more of a naturalist. I'm a patterns guy. So what I do is I look at things that are going weird in your body, and my goal is to actually get you back to normal function. Okay, so again, my training, I've got a bachelor's of human physiology, so I understood how the body worked. Then I understood kinesiology and integrated how the body works, affecting movement, affecting how the body actually functions. I covered nutrition, I've covered medical views. I was going to be a surgeon at one point in my life. I wound up getting my minor surgery off in the state of Oregon. Still prefer not to cut people open to use it. But again, the bigger thing I'm going to say is that once I started learning more about nerves, it completely changed my view around. And I just said, what do nerves control in the body? Like everything. So in which case, the brain controls the body, and if we can get that signal working good, then the body should go back to better function. And that just made sense to me. It resonated with me. So since that point, that's when I became a chiropractic physician. And I thought I understood what chiropractic was, but it blew my mind how well I'd be educated by the time I got finished up. At the same point, I've studied over 47 techniques. I really have a different understanding than a lot of people do on how bodies function and actually how they heal. So what we're going to do today is we're going to cover 4 steps that are going to help to get your body back to a better state of function. I'm going to try and keep the science down to a minimum. I've done science in quite a few of my videos, and the truth of it is, a lot of people, it's just too much for them. So we're going to try and keep it on the low scale of things, but trust me, I can back up all these sort of things, and I will put links down below so you can go down and look, and I'm going to try and give you some easy references you can do to try and look at this information up on your own. Right off the bat, the first things I'm just going to say is I'm good with differential diagnosis, that ability to figure things out. At the same point, I'm a patterns guy, so I'm going to utilize those 2 things to show you things that we can do to help get your body working better. Right off the bat, let's cover those 4. Number 1, the most important one, which is what we've been talking about right off the bat, to try and get your body working well, is self-protection. So right off the bat, washing of those hands, okay? There's 3 people in history that we need to talk about. Ignaz Semmelweis, Joseph Lister, and Louis Pasteur. These 3 individuals are the reasons that we're still washing our hands 175 years after it was first introduced. That hand washing is going to help out protecting patients and at the same point decreasing the chance of mortality and infections. And the reason that we're using those things 175 years later is because it works. There's nothing else about it than that. So let me explain that just really fast. When you actually have soapy water and you actually put soap onto a greasy, oily dish, rub it around for 20 seconds, you wash off, what happens? It's all nice and clean now. Well, what did that do? It basically emulsified all the fats to actually break those apart so it can actually be cleaned off. Now, when you take a virus, what you do is, virus has what's called a phospholipid bilayer. Now, lipid means fat. So when you put that soap and water onto that virus right there and wash that for a good 20 seconds, singing happy birthday or the alphabet, whatever it is that you're doing, what that'll do is it actually helps to emulsify that outer layer and breaks it open so that their guts will spill out into the open. And what that does is now, for all intents and purposes, you've actually killed off that virus and its contents are now going down the sink. And so that's why we wash our hands with soap and water, to actually get the viruses and bacteria out of the way as best as we can, so we can actually function a little bit better on that way. The second thing of that first part we need to know is covering ourselves with PPE, which is going to be things like wearing masks, wearing gloves, depending on your exposure level to people. You've got to understand, we do transmit through respiratory droplets, through sneezing, through coughing, through touching our hands and face, and then touching something else and transferring that over to other people. So we've got to watch out for those sort of things. So cover yourselves up as best as you can. Watch social distancing so you're not so close into and exposing yourself to other people's bacteria and viruses, or you're not actually giving them yours. The same sort of thing is that if you've got a cough and sneeze, try and protect yourself so you're not spreading that stuff around. You want to cough into that elbow, get that stuff working better, coughing and sneezing there, or you just dab on people. What's up? But anything that's going to get you working better, we want to be trying to look at those sort of things. So again, protecting your body. So now going into the internal body preparations, I'm just going to be fast along these lines. One of the biggest things that we learned about when I was in microbiology in school was that we went off and we swabbed a bunch of things around the place, human body parts, toilets, money, and doorknobs and everything like that. And do you know where the biggest amount of bacteria was ever found? Always? The human mouth. We have bacteria in here all the time. So my big question is, why aren't we sick all the time when the same bacteria is always in your mouth? Well, because your immune system is supposed to keep those things at bay so you don't manifest it. When your immune system gets knocked down, then those things are allowed to grow. So that's why we're going to be covering that stuff also today. Okay, so right off the bat, like I said, we wanted the PPE is the first things you need to be looking at, and then we're going to go over into internal body preparations. So of those four things that we're looking at here, one is going to be the washing your hands and the PPE. Number two, you're going to be looking at this paramount. One of the biggest things you need to focus on when you're dealing with anything dealing with lung-related products and disease processes. When you're looking at things like pneumonia, bronchiectasis, bronchitis, croup, COPD, asthma, allergies, colds, cold flu symptomology, these are all dehydration-based diseases, meaning that they need water and oils, lubrication centers to actually help support your body and get those lungs working better. They need to be moist and functional for you to transfer oxygen between them. Otherwise, they start to dry out. And the research articles, if you look down here, there's 3 articles that I'm talking about. 3 articles that talk about from Harvard University basically stating that there's been a link found with regards to dry environments and bacteria and virus increases. So, dry environments, not just talking rooms, bodies also. Okay, so when you get dry on the inside, your body can't function as well, and you're allowed bacteria to start growing in those areas. So, right off the bat, you want to boost up your lubrication centers, which is water and oils. Boost up water, about 2 to 4 liters of water for the average individual. If you drink things like coffee, pop, tea, alcohol, you probably need 2 cups of water for every 1 cup of those bad things you've had. Meaning that if I had 10 ounces of coffee, I will need 20 ounces of water to counteract that coffee. And that's above and beyond the 2 to 4 liters we should talk about per day. But those are going to help to get the body lubricated. That's the first thing. The second thing you want to be looking at doing is good oils into the body. Oils do about 4 different jobs. The ones we care about here in the clinic is going to be lubrication from the skin, from the head down to the feet, lubrication of the outside body. At the same point, should be lubricating from the mouth, nose, all the way through foot-to-fitted tubing out the back door. Third thing it does, it helps to make all the anti-inflammatory hormones in your body that actually deal with inflammation and pain-causing things. So you've got more of those anti-inflammatories going on, which is actually what respiratory, acute respiratory syndrome is. You're getting lots of inflammation there. This helps to bring down that inflammatory response. And then the fourth thing that these oils do is they help out with good nerve function and regeneration. And where's the biggest collection of nerves that we know about in the human body? The brain and the spinal cord. And what does the brain control in the human body? Everything. Thank you. So my goal is to do is support the body, get it to a new level of function, get it working better so your body can move beyond this and actually start to heal and fix itself up. And that's what I'm looking at doing, is trying to get you back to normal parameters. So first thing we're going to be looking at, dealing with PPE. Second thing we're looking at, lubrication centers. I'm just going to put up a little bit of an article that was listed by the NHS and the CDC with regards to the main symptoms of COVID-19. And then I'm going to break it down to what it is that I do, which is differential diagnosis. And I'm going to teach you the things that you can be looking at doing that's really where the symptoms are coming from. So each one of these things has a certain reason that it's getting there, okay? So my goal is to track down those reasons. So right off the bat, the main three things for COVID is going to be fever, dry cough, and a smell and taste deficiency. So in which case for fever, you're looking at a high temperature of about 37.8 degrees Celsius. You're looking at 100 degrees Fahrenheit. For a dry cough, you're going to be looking at a new continuous cough that occurs regularly throughout the day. It's going to be roughly about 3 times within 24 hours. And the smell and taste is going to be a new loss in the sense of smell and taste. So of these sort of things here, let's explain that into what I look at for the body. When you say that someone has a fever, that tells me you're probably looking at a lower cervical irritation. The C7 nerve goes into the thyroid, and the thyroid deals with heat generation centers. You irritate the nerve like putting an arm on a chair effect. Put your arm over a chair and leave it there for a while, your arm's going to do something weird. It'll go numb. But it'll do a lot of other weird things too. Numbness, weakness, tingling, pain, turn blue. A lot of weird things. But those are symptoms. Because if I take my arm off the chair, the arm should go back to normal. And that's what we're trying to do, is get you back to normal. So when you have nerve irritations going on at the C7, you can cause that to manifest and cause it to change its function. So what it thinks is that 98.6, it's really cranking that temperature up higher. And until you correct the nerve, then it resets itself. How do I know this? Because I've had plenty of people, 70% of people after a car accident will come in with signs and symptoms of colds and flus. I've done over 17 years of car accidents, and I'll tell you, I have people come in sicker than a dog. I adjust them that same session, and they leave without a cold or flu. What? I am serious when I say that. That means that's a symptom, and that's not bacteria getting run out of your throat because I just adjust your neck. No, irritated nerve does something weird, take the irritation off, you go back to normal. So, C7 nerve irritation can cause thyroid heat generation center issues. If you're looking at a dry cough, come on. When you say dry cough, what it means is that you're not coughing anything up. When you're coughing something up that's expectorated, that's going to be something like mucus. Mucus is going to be found with bronchiectasis, bronchitis. You're going to be looking at cold flu symptomology, from lung irritations by actually having other things in it. But the truth of it is, when you're looking at the dry cough, usually dry means dry. If it's dry, you need more lubrication centers. Your body's dry. If you irritate your lungs on the inside, they get inflamed, and then that will cause more agitation. Agitation, we try to cough to get those things out. You can't put your hands down your throat and scratch it to get the irritation gone. You got to cough. That is the only thing we do for lungs. When you're looking at the smell taste, when you're looking at chiropractic aspects, when you look at us carrying stress, we carry stress in our head, neck, and shoulders, okay? So when you tighten up your neck and you pull that back of the shoulder up towards your ear, that is the direction that causes the cold flu symptom. Now, when you irritate the upper cervical at your C1 will go and affect your cranial nerve 1, and that is your olfactory centers. That's your smelling centers. Also, underneath the tissues of the skull, just inside the skull, you actually have the cranial nerve 7, cranial nerve 9, and cranial nerve 10. And these three also deal with taste sensations. So when you actually crank your neck backwards because your neck, your shoulders are tightening up, what you can do is you can irritate those tissues and press them in and cause a suppression of the nose and the taste buds, and you'll have decreased smell and decreased taste. So if you actually decrease the stresses on those, there's a really good chance it goes back to normal. So when we start looking at what CDC says for additional symptoms that you can be looking at, I'm just going to read these off. So we got shortness of breath or difficulty breathing, 22%. Fatigue, tiredness, 35 to 39%. Muscle and body aches, 16 to 36%. Headaches, 12%. Sore throat, 12%. Nausea, vomiting, 4 to 6%. Diarrhea, 5%. Congestion, runny nose, roughly about 3%. Now, if you go take a look at all those things underneath that, I am not joking when I say this. You can turn these things around by actually getting these things taken care of. Shortness of breath or difficulty breathing is dehydration, and muscle imbalances can cause those things. Fatigue is going to be dehydration. Less water. You know what? Just pause this and read. Pause and read. Okay? Muscle aches, we're looking at dehydration. Headaches, dehydration, and 80% of headaches are caused through neck muscle imbalance. 80%, so that's going to be muscle imbalances also. Sore throat, dehydration and muscle imbalances. Nerve irritation, or we're looking at dry nose through postnasal drip because your eyes were dry. Nausea and vomiting, going to be looking at muscle imbalances. Again, C1 can actually affect, when you tighten that up, can actually affect into your stomach. And if your stomach gets all thrown out, then you'll feel like vomiting. A lot of people that actually wind up getting head injuries, they will feel like vomiting. And the reason that is because when you have so much neck instability, the upper cervical has so much innervation throughout the entire body. It has to coordinate itself with almost every single joint in your body. And if all those balances are thrown out, it puts so much stress onto your brain that your body goes and says, even digestion is hard at this point. I don't want to do that. So just purge it, get rid of it. So it's either going to be this way, it's going to be out the back door, the other way. So again, that's the next thing you see below that. Diarrhea. Again, same thing, muscle imbalances in your neck can actually cause you to jack your body up and cause you to throw out the upper and lower counterbalance system. Your uppers and lowers have to talk together and have to work together. They have to. You can't support the body without having the head drive properly. You can't drive it properly without it being supported properly. These things are two paramount things. So if you throw that balance pattern out, the body just says, purge so I can actually do better. And then the last one is going to be congestion or runny nose. And that's going to be dehydration aspects. Well, you'll notice that your nose closes off one side to another side in half an hour. Every half an hour it swaps outside. But you'll notice you get little crusties in your eyes, nose. You'll notice that you are coughing up phlegm, a lot more phlegm. What those things are, those are all symptoms of dehydration in the body. You want to get into this stuff, go back and watch my previous videos. We're going to get into the science of that sort of stuff. So these are the things you want to be looking at. Third thing you're going to be looking at doing is going to be dealing with nutrition. The nutrition research that's out there that has the most effectiveness that we're looking at is going to be vitamin C, vitamin D, vitamin E, zinc, selenium, and the omega-3s. Of these ones, I'm not going to get into everything, but you can see there's going to be the little pop-up I'm going to talk about. The sources of this nutrition, you can get them from a lot of different areas. The truth of it is, most of this stuff you're going to get from green veggies. So water, green veggies, great sources. You're going to be looking at zinc, you're going to be looking at things like, say, nuts, natural sources along those lines. But the truth of it is, look up on table 4 of the article that we have down there with regards to the is nutrition good for COVID-19. And then that will actually help to get you understanding that one better for the amounts of effective dosages we should be having, okay? The fourth thing that we're looking at beyond that is going to be the cold flu stretch. I'm going to basically cover those things. 3 years ago when I had people come in after New Year's that had cold flu symptomologies, every single one of those people had irritated neck patterns up and through necks, right up and through here. And so those areas are the things we need to be looking at stretching. When you're looking at these sort of things, we need very, very, very specific stretches. And of doing that one, you need to get it moving in a specific parameter. Just going in there and doing any sort of neck stretch is not going to cut it. I've covered it 2 different ways. I've covered your regular neck stretches and I've covered cold flu stretches. And I want you to go off and take a look at the cold flu stretch. The cold flu stretch is going to be the video has all the physiological process of what causes these areas to be irritated upon. It also tells you the exact stretch. Basically, the things you're going to be looking at doing is a flex forward and an ear off to a shoulder. And you're going to be getting specific stretching out of that to get those things moving better. So, the things that are needed to counteract symptomology of cold flu symptomology and COVID, and for these for this dark winter we've got coming up in here, is going to be personal protection, lubrication centers, nutrition, and stretching. So if you like the information we just talked about, please give us a little thumbs up. Let us know we're on the right track for getting the content you want to hear. At the same point, share this with your family, friends, and loved ones. Get this information out, everybody. This is the most current information, and this is the stuff that actually has fought my patients, helped my patients fight COVID and cold flu symptoms. Like I said, I don't get colds and flus anymore. I haven't had them for about 11 years. This stuff works. Try and have yourself a great day. I'm looking forward to actually catching up with you soon. Talk to you then. Bye-bye for now.